And right now, that's another exciting talk from Dr. Amer Siddiq, who is Associate Professor from University Malaya. He's going to share with us how physiological and psychological factors influence performance at work. Before I give it to him, I must say, he has done a lot of work. It's very, very exciting. If you need to Google Dr. Amer out and probably find some information about him, right? Something like the cyber folks are doing. And he does a lot of activities, especially with the UMCAS. And he has got cool ways on how to reach out to people, how to look at the sentiment. And he has got videos that when you see it, it relates to you directly and you know what message is going to go ahead and share with you. And just now, we had Abang Malik who was talking about nasi kandar from Penang, which is actually a delicacy of Indian Muslim cuisine in Penang for those who are not from Malaysia. But Dr. Amer actually has this chendol for the soul, right? Another dessert item that he shares with the folks out there. So let's get to the talk. We're giving it to Dr. Amer Siddiq, who's going to share with us how physiological and psychological factors influence performance at work. Take it from here.
Thank you very much, Madam MC, and also thank you very much for the Yayasan Health of the World for inviting me this evening to actually present a little bit about the physiological and psychological factors influencing performance at work in this conference, which, sadly we were prepared to have it in a hybrid situation, but things have changed as they do very rapidly, and the situation is quite fluid. But nevertheless, the show must go on, and we will definitely, get this show off for you. So what I want to do, I'm just going to share you my screen. So just to give a little bit of a background, what I'm going to do today is we're going to be discussing a little bit about health, and then followed by the role of stress in performance, before we move on towards mental health and performance, and end with what I think ways that organizations particularly can help and improve performance in the workplace. Along this particular conversation, I'll be trying to include the physiological and psychological consequences that might affect either good performance or negative performance, and then we'll have a little bit of time for discussion. So I'm really hoping to get this wrapped up within about 40 minutes or so that we actually have some time for discussions at the end, yeah? So I think just to start this conversation, because I think it's really important for us all to be reminded, if we've not been reminded yet, is that the World Health Organization has actually defined health to be a situation where you have complete physical, mental, social well-being, without just merely the absence of disease or infirmary. It's really important for us to take note of this, because what it means is that health includes a physical component, a social component. That means that we want individuals to be able to communicate with their loved ones, be able to communicate with each other, and also to have a mental component as well. So people who might have difficulties in one of three of these components could be classified based on the World Health Organization to be unhealthy. I think that's the first thing that we want to take note. Now, mental health, on the other hand, which is often a neglected, in a way, a neglected part of health, if not even ignored altogether, is a situation where an individual is able to realize his or her own potential, can cope with the normal stresses of life, can work productively, and is able to contribute to community. So if one of these four segments also is not present, therefore individuals could be considered to have a mental health issue. And I think we need to really be very clear that a mental health issue does not mean that an individual has a mental illness, but it merely means that one part of the three components of health is not functioning as we would like it to be. Now, if you look at the definition of health, I think I just wanted to stress point 2 and point 3, where number 1 is that individuals can work productively and fruitfully. And I think this is where the performance at work really comes in. Individuals who are struggling with a psychological or an emotional or a mental health issue will then definitely have some issues with regards to performance. Secondly is that if an individual is unable to cope as a result of their mental health issues with stress, in general, as we'll see later, it plays a huge part in actually influencing the ability for you to actually conduct and complete the task at hand. So I think these 2 points are really important for us to take note of when we're looking at this issue of mental health. Now, if you wanted to put it into a more immediate context, if you're not yet aware of, we know that during the COVID-19 pandemic, although some of us here are very fearful about the physical health issues as a result of COVID pandemic, what's happening in the background, which we might or might not realize, is there is also an ongoing mental health pandemic working hand in hand or working in parallel with the present ongoing COVID-19 infection pandemic as well. However, as we know and we've seen and we've read, a lot of focus has been put on to the physical aspects of COVID-19. Very little has been put on into the psychological or mental health aspects. And this, as we'll look on later, will definitely influence the individuals that are trying to get task at hand completed, or those of us who are leadership at this point of time, trying to assist colleagues and young members of our organization to actually work as productively as they did as late as 2019. Yeah. So this is when the changes, I think, really has started to happen. Now, why is it so important? If you haven't realized yet, mental health is important for throughout the development of your lifespan, whether it is when you were a child, in terms of trying to develop a personality, in terms of developing confidence, in terms of developing, your ability to study really well, or whether it is for you to transition between young adult to adulthood, for example, and also into the transitioning between adulthood into parenting, where good mental health is really important for us to be effective parents, to maintain relations between husband and wife or partners. And then, of course, when we are talking about here the performance at work, in terms of work, and we've seen just now that the ability to work productively is a positive or a needed component in terms of mental health. So again, the ability to work productively at your highest level is part and parcel with a positive mental health. And then before we dismiss from this world, as we grow older and weaker, positive mental health is also really important for us, not only to improve and maintain our quality of life, but also to maintain our quality of health as well, because as we know, poor mental health will lead to a poor physical health due to poor compliance to the necessary things that we need to do in order for us to maintain good mental health. So mental health is really important throughout our whole life. However, of course, for us here, we are sort of the converted. Therefore, we are, we've put a bit of emphasis on mental health, but there are probably many out there who still can't seem to see how mental health actually influences health and how this health in general influences the ability for us to function at work and beyond. Yeah. So what about in terms of work performance? And I did a little bit of work trying to figure this out as I was preparing this presentation for you. It's interesting to note that although we often talk about work performance, when we're looking into the literature of work performance, it is often poorly defined. And a lot of this focus has been looking at the various types of work performances out there, depending on the theory of psychology that individuals are in. So if you're looking at, for example, the perspective of human resource or organizational psychology, often they talk about work performance being related to organizational outcomes and success. So it's really important for us to say outcomes and success. But when you look at psychological components, work performance is often described on the individual level, and it really signifies what an individual does in order to perform that particular task that was given to him or her. Yeah. And often this is where the concept of work performance is often also referred to the ability to perform a certain work well. And I think it's really important for us to think about this a little bit, because according to one of the leading authors in work performance, particularly looking at it from an individual point of view, what he's trying to say is that work performance is often a behavior. And it's a behavior that's specifically done by somebody who is at work or working for somebody, an employee. Yeah? It is different from an outcome, which is sort of the kind of angle that people that are looking at work performance from an organizational point of view often talk about. And one of the reasons that Campbell has mentioned this is because he believes outcomes has many many avenues for outcomes to be actually changed. Whereas if you're looking at work performance from an individual point of view, it is really the behavior that will determine whether an individual is able to work well or unwell. And often work performance is going to be related to productivity. It often is related to a value or has a value or value laden towards it. And it often needs to have a goal as well. So these are some of the concepts of work performance when we're trying to think of how does physiological, psychological components influence work that is being able to be produced or to be provided. Yeah. So this is where it comes in. So when I was looking into this topic and really trying to understand this and thinking about the various talks I've given for other individuals and also organizations, it really does still boil down to stress. And I think the topic that we're talking about today, whether it's physiological, i.e. a physical contribution towards performance, or a psychological, a mental contribution towards performance, is going to be back related to stress. So, if you're going to have any take-home messages, it's really how do we make sure that stress is, as I've shared with you here, a friend or a foe? Because there's always two sides of the story in terms of stress, yeah? Is it a friend or a foe? Often we talk about stress in the negative context. There are lots of courses about stress management, how stress actually is detrimental towards our physical health in terms of developing cardiovascular disease, for example, in terms of developing diabetes. At the same time, we talk about stress as being a negative in terms of developing mental health issues. As we'll look on later on, things like depression, anxiety come to mind. But at the same time, without stress, as we'll see a little bit later, we're unable to do work. So in a way, we do need a little bit of stress, but at the same time, we do need to make sure that we're able to manage the stress. So if we look at the definition of stress, it is something that is normal. It is a normal reaction to change. Whether the change is moving forward or the change is moving backwards, it is that particular change, reaction, that stress comes into being. And it can affect the individual, whether it is a physical attribution, a mental attribution, or an emotional attribution. We'll look into the various symptoms as well of stress that would contribute towards this particular issue. Now, looking into this curve that was actually provided by Kupfer, the Yerke-Dodson's curve, which has now been modified, and this is adapting it with other theories in terms of stress management. And thinking about this a little bit more, and where does work performance comes in. So if you're looking into the graph on my left, on the human performance curve, if there is no stress at all, the individual is going to be highly complacent. Bored is the word that's been used over here. And if you look into the command demands as well on the other curve as well, you'll see that if there is no stress, there will be uninvolvement in these individuals in terms of the task at hand. Now, most of us are working or have worked or definitely have studied before in the past where you've had some level of deadlines. So a deadline contributes towards adding a little bit of layer of developing some amount of stress. And once we're getting closer to the deadline, we start to feel a little bit impatient. We start to feel a little bit active and alert in terms of trying to get the job done. And therefore, stress becomes positive at that point because it's allowing you to work. At this point of time, often your performance, if you're looking at the behavior and looking at the ability to work productively, will start to kick in. Individuals will start to feel that they need to get something done. They will start to be looking for the answers of the question that was actually posed. Now, if you're somebody that's able to plan and actually time the amount of stress that you give to yourself with the amount of work that you're actually done, you're going to reach optimal peak performance. Yeah, you're going to reach optimal peak performance where we could consider the stress to be positive at that point of view. But there'll be some of us, myself included, who might actually defer some of this work to the very end. And what happens then is that you will have either the ability to complete the task at hand, or you'll have a sort of a complete meltdown of the situation because you're unable to complete the task at hand. So this is when the stress starts to become a little bit negative in terms of the individual. It's positive that it's pushing me towards getting my job done, but because of maybe my personality that's a little bit a procrastinator, for example, or my belief that my ability is beyond what I'm able to do. Therefore, I let time go on a little bit before I actually start getting going in terms of the work that I do. The stress starts to build up. And the ability for you to cope with stress is really going to be the component at that point of time. So what happens if I'm unable to complete the task, or I'm feeling, the inability because of other stressors that comes in? I start to feel a little bit distressed. And often this is just beyond the optimal performance, going down towards the right hand of our curve at this point of time, where individuals, if we're going to use a traffic light system, green, yellow, and red, is starting to be in the yellow, moving to the orange zone. Now, if for some reason or another, there is another stressor that came into my life, for example, to give an example of how my performance is going to be affected by the psychological and physiological components of stress, we can see that probably at that point of time, if there was an added work that I didn't prepare for in my timeline, I will start to be more and more distressed. And if I allow this distress to continue, I'll probably be impaired at that point of time. So when you're moving towards distress, towards impairment, what we often see is that the work performance just dives. It just literally dives at that point of time, leading to individuals to be unproductive, unable to complete the task at hand. And for some of us, start to develop medical complications, whether it is psychological or physical, as a result of the prolonged stress that these individuals develop. So what are some of the symptoms of stress that we can sort of link to the performance at point? As we can see here, people who are in distress will often have a myriad of physical symptoms, particularly in terms of, for example, dizziness, aches, pains, headaches, palpitations, particularly. They might also have psychological symptoms. Anxiety comes to mind, anger, distress, depressed, for example. And for some of them also will develop behavioral symptoms, which are again going to be counterproductive in terms of getting the job at hand. Absenteeism is being one of the common ones, i.e. the person doesn't go to work, or presentism. In Malay, we call it buat busy. The individual is at work, but he's not doing anything at all because the amount of stress, as we've seen here, has gone beyond the ability for that individual to cope. So this leads to individual really struggling in terms of getting their work done. So it's really important for us to make sure that we are really at the optimum level of stress due to, as a result of the work that we're doing. Yeah. So as I've shown here with you here, based on the Harvard Business Review, absenteeism and presentism really is something that is costly, and it is probably one of the performance stealers as a result of uncontrolled stress. Yeah. So when we look into the mental health aspects of performance, what do we find? So I think there are going to be lots of external and internal stressors that might lead to individuals having problems at work. Yeah. And this is for most of us who might be leading organizations that you might want to think about. Consequences of distress at work often leads to high levels of absenteeism, as I've shared with you just now, increased staff turnover, which increases cost, work accidents, low productivity, poor quality of production, frequent breakdowns, and difficult interpersonal relations. Yeah. Consequences of distress, prolonged stress at the workplace also leads to individuals being burnt out. And this happens to be one of the major mental health issues, which has a physical contribution in terms of lack of productivity. And we're seeing more and more of this happening at this point of time. In fact, I've been asked to comment on our current feeling of malaise, our feeling of fatigue as a result of the pandemic, which has been given terminology like pandemic fatigue, or just feeling, just feeling inactive as a result of the prolonged internal and external stress that we're all feeling as a result of working from home, for example, or being, afraid whether we'll be contracting COVID or not for the last almost now 1.5 years of our life. Yeah? So this has resulted in a number of individuals coming forward for something called burnt out, and a number of organizations also coming forward asking, how do we manage not an individual who's burnt out, but a whole team of individuals who are burnt out, which definitely they can see in terms of performance has resulted in an organizational drop in productivity. So this happens to be quite a big topic that's being discussed at this point of time. So what is burnt out? For some of us who might not be familiar with burnt out, it is a state of emotional, mental, and physical exhaustion caused by prolonged stress. Again, if we're relating it to what's happening right this point of time, COVID pandemic is definitely something that is chronically, long-term, and is causing a lot of us a lot of distress or increased stress as a result of it. Yeah. So burnout may also be another manifestation of a mental health issue, but generally, as we'll see here, there are going to be certain factors or items of burnt out that actually makes it a little bit more towards distress rather than an impairment. So the first thing is that individuals will often have emotional exhaustion. They will often have alienation of the job given to them. So they're only specifically going to get this exhaustion and reduced performance at the task or the job that they are doing at that point of time. If they're asked to do something else, for example, if they're working in an office and they go home, they're able to function at home, but they're unable to function in the office. For example, for some of us who might have wives or husbands who are either house husbands or housewives, for example, where primarily the job is at home, they will be unable to function at home, but will be able to function out of home. So that at that point of time, individuals are probably going to be struggling with burnt out. Yeah, this particular phenomenon, which we see and have getting more and more familiar with, causes not only physical exhaustion but also psychological and emotional exhaustion. And as you can see down here, definitely is going to be a cause of poor work performance. So these are some of the causes of burnt out, and I just wanted to, I've just specifically highlighted what I think are sort of the factors or causes of burnt out that is more relevant for us during this period of time of the pandemic. Yeah? A lack of control of our surroundings. You know, for some of us in Kuala Lumpur at this point of time, and probably the whole of Malaysia, we're not sure whether today is the last day for us to go to the shopping malls. Tomorrow we might be, in a prolonged 3-week at least, full lockdown. And this is causing some of us to feel a little bit distressed. For those of you who are doing your conference call at home, who might have work-related items in the office, you might not be able to go back there tomorrow. So this is definitely going to cause some of us a little bit of stress. For some of us who have certain jobs that require us to travel, there's no traveling anymore. So the unclear job expectations causes individuals to also struggle. Dysfunctional workplace dynamics, not being seen much nowadays. This used to be the problem where you might have a toxic work environment or gossiping at work, for example, which might cause a lot of difficulties. Most of us are working from home, therefore that's not going to be an issue. Mismatched values happen to cause poor job fit at this point of time, or lack of social support from your superiors, for example, is really important at this point of time. Are causes of individuals starting to struggle with their emotional, psychological, and physical well-being. Yeah? Lack of social support, if you think about jobs at home, house husbands, housewives, in the past, and I was just discussing this with another colleague just now, in the past, the individual at home has a routine, a system that works for them. Yeah, the children go to school, the husband or the wife goes to work, they do their tasks at home. When evening comes, after they've done whatever they need to do and spend time with themselves, their family comes home again. But at this point of time, over the last 1 year, most of us are working from home. So probably the most stressed individual that is starting to really come forward in our clinics at this point of time are not really the workers at the workplace. It's actually the housewives and house husbands as a result of the prolonged stress that they're going through, having their families with them 24/7. Yeah. So individuals who are unable to manage distress will then start to develop impairment. And the difference with impairment is that it's going to be a problem with regards to both physical health and also mental health as well. And an impairment, often if you're looking at the mental health aspects, is when the individual loses function. It's often irreversible in the sense that you can't do simple interventions at that point in time for you to go back to the green zone. You probably require some level of assessment and treatment at that point of view. And two common mental illnesses that have been often associated with poor work performance as a result of prolonged stress is going to be depression and anxiety. And I think one of the concerns that we have in terms of depression particularly is that we could also have situations where individuals will commit acts of premature death, for example, which again will reduce productivity even further. So these are just some of the consequences of negative stress that happens to individuals, which often can lead to problems at work for these individuals as well. So what can we do? What can we do as an organization? What can we do as an individual in order to boost and assist individuals to be able to work productively and also to be able to have positive stress? Yeah. So we can see that these are some of the limitations that we've seen in terms of organizations in increasing stress at the workplace. Inadequate health and safety policies. If you don't have a good health and safety policy, you're probably going to be causing more harm than good to individuals. So we are currently, for example, working with organizations in terms of developing certain policies to improve their workplace so that it's going to be a more positive environment for individuals to be working. And hopefully with the reduction in stress in these individuals as a collective group, then it will increase productivity at that particular workplace. Poor communication and management practices are also a contribution factor. Limited participation in decision-making, low levels of support of employees, inflexible working hours, and unclear tasks or organizational objectives also contribute towards increasing the stress at the workplace and reducing work performance as a whole for that particular individual. Now, I wanted to stress for the Malaysian group that actually we don't have to think too far, because in the Ministry of Works and Human Resource, there is already a guideline that you can use in order to improve your workplace, or even to look into your own well-being in terms of stress and managing mental health at the workplace. However, as I've been shared by the group that actually does this, sadly, most of our employers are not aware of this particular guideline. So these guidelines are actually quite robust and complete. It tells us about the preconditions that might contribute or might be affecting or might affect work in general. It provides you with environmental interventions that people can do, organizational interventions, and also for leaders, it also looks at interventions on the individual level. And I think this is where it's important for us to just have a look at this if you are not familiar with this particular guideline, because there are lots of tips in there that we can actually learn from. But I'll share with you a little bit of it so that we have a little bit of a flavor of it. Now, it's really also important for us to invest in a healthy workplace, because a healthy workplace allows individuals to thrive as a result of providing a positive mental health and mental well-being, apart from physical and social well-being as well. Yeah. So what are the preconditioning that they recommend for organizations to think about? So first of all, for every organization, it's really important for us to talk about things that we're talking about right now. How does stress affect you and I? Providing some level of awareness in terms of the consequences of good and bad stress. Providing information about where to come and seek help if individuals are developing problems, and also providing tips on managers, particularly on how to manage subordinates, particularly in different time periods like now, COVID-19 pandemic. Yeah? It's really important for organizations also to have a very clear and concise communication and information dissemination program, whether they have a corporate comm, whether they use email, whether they use other social media for their individual organizations. It's really important that they have some method to actually channel information across. Yeah, and also I think it's important for them to develop quality workplace culture. Some of the things that have been recommended in terms of environmental intervention is just generally to improve the general environment, making sure that it's a clean working place, probably a lot of greenery. This has been shown to assist. For some particular organizations, you might want to have a more lateral type of or an open plan concept. For certain work, that might not be suitable, and having that might be a very stressful situation for them. So you might want to start developing more closed environments for these individuals. So having a general, improving the general environment actually assists in improving performance at large. Yeah. Improving the workspace design. I often talk to organizations saying that if they're expecting you to work full productivity when you're working from home, knowing or not knowing how your work environment is, it's a little bit unfair, because at the workplace, for example, often the interior designers look at the table and chairs that you're using in order to give you the most comfortable table and chair, the right level of computer space, for example, for you to be able to work productively without having any, work-related physical problems, nor issues like headaches and, strained eyes as a result of the ergonomics that are available. But at home, that's totally different. So some of these companies have been a little bit more proactive during last year particularly. Once they've decided that the company is going to be working from home for the whole year, the whole company gets a work chair and a laptop from the particular organization, because some of them were using desktops at that point of view. So it really depends on the organization in terms of how you're going to improve. Some of them will be given headsets that are noise cancelling, because they know that some of you might be working or living with other people. So definitely having a noise cancelling headset, a laptop that has all the gadgets that you need, having the right chair. It doesn't matter where you are, at least this is sort of a kind of help that might be able to enhance your workplace. Of course, if you're in the office, all of this is already provided for you. Yeah. Interfacing or improving the interface of technology is also really important. That means not introducing Zoom, for example, without giving a briefing on how to use Zoom. If you recall last year, when all of us were asked to go and work from home, lots of organizations, particularly in the public sector, including my university, suddenly expected all of us to change in using Teams, Zoom, Google Meet, when some of us have never heard of probably Zoom and Google Meet before. And if you remember thinking, if you have children, some of you might have seen that, if teacher A is comfortable with Zoom, they're able to use Zoom. And therefore they ask everybody to use Zoom. If they're better with Google Meet, they'll ask you to do Google Meet. So it really is difficult for the child to also reach his full potential if he can't get into the channel, because, mom and dad doesn't know how to use it, and nor do you. So, really introducing the technology before we expect people to work productively is actually really, really important. Other interventions that organizations have been encouraged to do is things like changing the work practices. This is something that is happening right now. Working from home is a different work practice altogether. Making sure that when you're working from home, you're still working from 9 to 5, not 9 to 9, which is happening in most organizations. Improving job content. I had a lot of trouble in terms of making sure my driver and my personal assistant had work to do, because especially for example, office boy and girl, where they really do work when they're in the office and suddenly you're working from home for 3 months, we really needed to improve and change the job scope, because if not, they would be, as I've shared with you just now, in high levels of stress, expecting to work productively without having a job scope that is aligned with what is happening at this point of time, but yet at the end of the year expected to perform and produce the KPI that we expect of them. So improving the job content is really important for these individuals. Ranging working time and circulation of best practices is also something that is helpful. Best practices do help in terms of sharing with the people in the organization what we think might be helpful for them. And of course, at the final end here, interventions on the individuals is also quite important, providing them training and education. Counseling services like what we're doing right now and debriefing about situations will definitely improve the performance of these individuals, because they know what they're expected to do. They can manage their expectations a little bit better compared to when there's no debriefing or no information given to them in terms of the work that they are asked to do. So these are some of the things that companies have been recommended to do. Now, the World Economic Forum has also provided some tips and guidance as well. And it's really important that we take note that even if you build the best policy and you do all the changes that you do, but if you don't enforce those changes, for example, you say that you've got to work 9 to 5 when you're working from home, but you don't enforce the 9 to 5 rule, it's not going to work. So enforcement is really important in terms of ensuring that the internal structure is audited, or at least produces what they're supposed to do. Involving employees in the decision making is really important. Having town halls, although it's something that we don't like to do, it's really important to get buy-in, particularly when all of us here are struggling in terms of work and the work that we do, whether you are employer, employee, having you buy in into the agenda is also really important. And of course, during this period of time, really sort of talking about program career development and rewarding employees is also something that you could also do to improve work performance. Because there was another study looking at work performance and incentives. And I think now in 2021, for example, incentives is often talking about meaningful engagement. So organizations, new organizations, in order to entice young people, for example, not only talk about remuneration in terms of dollars and cents, but also in terms of value or in terms of meaning into the work that these individuals are asked to do. But for some of the senior ones who are not introduced to this new world, new age kind of concept, dollars and cents is something that they look forward to, as opposed to fighting for certain causes, for example. Or having a balance between the two is something that an organization needs to look at in order to improve work performance for them. Yeah. So these are some of the things that we can do. So I think before I end, I'm just going to be sharing with you some best practices that other companies have done, which I think was quite interesting in order to improve work performance in their organizations. So this was one that was done by Unilever, where they did something called Yumi Tea Now, because they sell both the tea, if you don't know. And they would have these sessions where individuals could literally, make themselves a cup of tea and just have a normal discussion about things that are not related. And they've managed to put some little quiet areas at the workplace to encourage these conversations to happen. They also have an internal bulletin where they would give tips on physical, social, and mental well-being for all the employees, and also would have sessions as well in terms of fitness regimes. I'm also aware of another company that is looking at this food, not Nestle, not Procter & Gamble, but another company looking at this particular area, where they've also in the last 6 months hired a personal trainer in terms of improving mental well-being through physical well-being. So everybody is given one of those Fitbits to the whole company, and they would then commission yoga instructors and physical fitness instructors to provide exercises, relaxation exercises, and physical exercises, where the people in the organization can compete among each other in a friendly way. But it also encourages individuals to start to do physical well-being work and also communicate through the various platforms, because they're all working from home. So they're having this online challenge, a visual challenge. So these are some of the things that people have done in order to improve performance at the workplace. Now, we've also tried to do a little bit of the same. And again, we got caught by COVID in university, where we launched a mental health initiative, which really looks at trying to manage stress and well-being. In fact, I've been asked by the Vice Chancellor to look into this a little bit more, because we're seeing a number of colleagues, support staff, and also academic staff struggling with their mental well-being and also physical well-being as a result of prolonged pandemic. Talking to our Deputy Vice Chancellor of Student Affairs as well, students themselves are also struggling because of the online learning that they've got to go through, and also the lack of experience that they have in a university setting as a result of the COVID pandemic. So, people have asked us to look into this particular area a little bit, but we started thinking about this as early last year, before the COVID hit. Literally about a week after this event, we were then, in the lockdown. So since then, we've really had some trouble in trying to revive this particular initiative. So I think just to end, so that I'll be able to take some questions and answers, as I promised, it's now I'll take about 40 minutes. I think mental health is, first of all, mental health is a component of health. And good mental health, as we've seen, I hope just now, assists and ensures that your work performance is at the highest level. Ensuring a healthy work environment is vital in improving mental health and improving performance overall. And I think this Let's Talk Minasihat, or a campaign or best practices, is really important for individuals to be able to find the support that they need to be able to provide the best work performance that they can give to their organizations at large. We're here and pass it back to our MC. For some of you who might want to be looking out for me later, you can, and we can have another discussion all together. If not, I'm more than happy to take some questions at this point in time. Thank you very much.